So, good morning, Malin. I'm very happy to be together with you today for this interview, which will focus on the role of WHO-UMC in this very important issue, which is the identification of medicinal products. So, Malin, I would like just to present you shortly, you are the product portfolio manager at UMC. Your major is in molecular biotechnology engineering, and you have a PhD in medical biophysics. And this within UMC, you're responsible for the UMC maintained WHO-Drug dictionaries, which are used for the identification of medicinal products and safety monitoring by all the national pharmacovigilance centers and industry. And you are also involved in ISO IDMP standards and implementation, of course. So I would just like to start with a very simple question to you, Malin. And why did you decide to take such an active part in the UNICOM project? You're involved in many work packages, and although you're not funded. So why did you decide to do so, and what is the role you intend to play in that IDMP implementation story?
Well, we were invited to take part in UNICOM, and I think it mainly was from the starting point from the role that we have in global pharmacovigilance. But then during the time and with the pandemic hitting off, we all saw, I think we all globally saw that there was an increased need for IDMP, and UNICOM is one of the most important projects. And while UNICOM was starting to move on, we were taking a more active role and to actually become the organization that generates and creates the PhPID. And I think UNICOM is a very important partner there because Europe is very unique with many different countries and has a very good initiative to standardize their medicinal product information. So we would be really happy to be part of that experience and learn and also contribute, for example, for the pharmacovigilance work that's been done within UNICOM.
But that was also a bit the questions. Actually, your role was related to pharmacovigilance, but now your positioning is basically to become a very important actor for the activation of multiple use cases which go beyond pharmacovigilance, right? So you decided to look at the issue in a much more global way, right?
Yes, because I mean, I think the IDMP standards were really created from the beginning, just looking at pharmacovigilance. But I think all the regulators moving forward realized that this is something you can use in the entire life cycle of a medicinal product. And if we have global identifiers that can support that, I mean, it's very important for WHO and then UMC as well to get that organized and make sure that that's available for all the regulators that want to use them.
Yeah, we'll come back to that because I think that's a very important aspect. Change management is really a big issue and a very important one. But before going into that, let's get into something which is very, very important in the IDMP implementation and in UNICOM, is this PhPID, basically, which should provide ideally a solution across all use cases for the identification of medicinal products, across use cases, across countries. So what is just your what could be the role? What is the not what could be, what is now the intended role of WHO-UMC in terms of governance and management? And can you detail us a bit what kind of timeline you have in mind now for a concrete implementation?
Yeah, so our role would be to generate and produce and publish the global PhPIDs. Together with those, you also need global substance identifiers. So it was just decided last fall that we will also produce those and distribute them. And we already are using the same system as is used in both Europe and in US, the SRS system, to create these identifiers and to distribute them. And our timelines moving forward is that right now we're in development of the systems that will support the operating model for PhPID, and we are collaborating through the Global IDMP Working Group on setting all the processes and business rules for the PhPID. And our goal is that during the fall of 2023, we will have an end-to-end testing using data from a number of countries to see if we can produce the PhPIDs in the ways that we have set up in the Global IDMP working groups in order to actually be prepared to go live with the PhPIDs in 2024.
Okay, thank you for this precise answer, Malin. It's in a bit my feeling that for some countries, taking this new role of WHO-UMC in global governance is a bit difficult to accept, just because it would lead to new requirements. But can you provide us a few examples of why this is so critical and so important, and why a central governance of PhPIDs is really needed?
Yes, absolutely. I think I will try to share some pictures actually, because it kind of makes it a bit easier. So since the PhPID is very central in IDMP, I mean, it is the link between different medicinal products in different regions. It plays a very central role. And here you can see a very basic sketch of the components of the PhPID and how it is created. So you need to have information about both the substance, the strength, and the dose form about the product. And if you look globally, this information is really not harmonized. But in order to create IDs that actually stands for the same and that maps the product, you need to have harmonized information, because the way ISO defines how PhPID should be created is a hash. So then you always need the same information entering the hash in order to get the same PhPIDs. So then, for example, we have worked a lot with the harmonization of the strength, and we actually based the initial thoughts on this on the work that was done within Europe regarding the definition of strength. So here you can see, for example, a cream that is present both in Sweden, in Belgium, in Mexico, and Colombia. And you can see it's the same substance, it's diclofenac, diethylamine, and it's a gel. So how hard could this be? Well, then you come to the strength field here in yellow, and you can see that for these different countries, it's all expressed differently. So 11.6 milligram per gram for Sweden, 10 milligram per gram for Belgium, 1 gram per 100 gram for Mexico, and 1% for Colombia. So in order to get the same input for the PhPID and actually generate the same PhPID, we need to decide on the rules for the strength. And in this case, we take the strength of the active substance, which would be 11.6 milligram per gram. And then you will have the same PhPID. Mm-hmm. Another example are for dose form. So in ISO, we decided that we think that the best way to harmonize the dose form is to break it down to the 4 characteristics that is used also by the European standard for dose form, IDQMs, to define a dose form. So here you have example from trastuzumab product from some different countries. And you can see that for some countries is defined as a solution for injection, and other is defined as something that is made for infusion. And here you really have to decide and harmonize in order to understand how do you harmonize the product. So in this case, we decided we should harmonize it to solution and injection. And also you can here see an example of the substance, where the substance is defined slightly differently in the different countries, because this is a biological substance. And here you also have to figure out that we think that they represent the same substance, so they all are trastuzumab. So there are many examples like this, and that's why we need a global maintenance organization that can take care of this work to harmonize the data in order to get harmonized and standardized PhPIDs.
Thank you very much for those examples. I think they are pretty much self-explaining. And I would like just to come shortly on the needs to adapt the roles. We see very much, you mentioned that you have been created to support pharmacovigilance mainly, but that we can't anymore stay all in our zone of comfort, and we need to consider the global ecosystem. So we see this is true for you, and you are actually accepting this change of role. And but this is also true probably for other actors which are key in the system, industry, of course, which needs to create the data at the beginning of the process. EMA probably has to adapt its role and also consider that it's also there not only for regulatory purpose, but also has a key role in distributing interoperability in Europe, and of course all the national competent authorities in Europe. What, in your opinion, you just mentioned that you're going to do a few tests with a few countries, but is there some resistance? Do you feel that there is some resistance, as I sometimes feel, from other countries? And how could we alleviate this resistance?
I think some of the resistance maybe stems to that I think the original thought with the PhPIDs were that they would be created locally or nationally. And I think it was not until we started to really deep dive into the detail of the medicinal products and how the PhPID were created until we figured out that it would be impossible, like in the examples I showed. So I think it kind of some of the resistance goes back to the understanding of medicinal products. I mean, they are very complex and they are very different, and different countries have different regulations, and I think that needs to be accepted. So even if we have IDMP implemented in all countries, I mean, that would really be wonderful, but it will take a lot of time, and we need to find solutions where we can use harmonized data much sooner than that. Because from the pandemic, I mean, you all know, we just learned that this is really key for us to keep track of our products and also to get products faster out on the market.
Yeah, well, you will be one of your colleagues will be part of the next community of expertise, which will take place in a few weeks from now. And how is the industry reacting to this global the global proposal of PhPID identification managed by your organization?
I think the industry is very positive. So they are taking an active part in the global IDMP working group, and they are very engaged, and they can really see the benefits from their side, having harmonized information that they can submit to different regulators when they want a product to be on different markets. And also, I think they see the benefits internally that using IDMP to harmonize information really streamlines their processes, and they can save a lot of time to have that. So I think they're very supportive.
Yeah, well, I could be a bit provocative in a way, because I could say that today, if we look at what has been done by a number of NCAs to adapt their IT systems and their databases, we know they will still need to make further adaptations in the future just to comply even with the workflow related to marketing authorization. So what would you say to the people saying, well, adding a few requirements finally, if it makes a big difference, it's not so much of an issue, right?
Do you mean for
Yeah, I mean,
the
we know that there will
regulatory
be
authorities?
several iterations in the development today because not everything is fixed, for example, at this point of time at EMA. And so taking into consideration further requirements is so much a big issue, provided that we have a global vision and we stick to it, right?
Yeah, no, of course. I mean, I think it's very hard for the competent authorities, and it requires a lot of resources.
Mm-hmm.
So I think you need to consider this as a project that will take time, but hopefully the end goal, when we reach that, we have really created something wonderful that's good for, you know, the entire world and society.
Yeah, and you mentioned it already, but I think it's nice that you can maybe reflect on the contacts which have been initiated with at least at the transatlantic level with FDA, and I think that FDA is also a strong supporter of the proposed PhPID management by your organization, right?
Yeah, they are a very strong supporter, and they have engaged tremendously with different experts in the global IDMP working group, and even their pharmacists have been collaborating with the UMC pharmacists on looking at different country data. So yeah, they have made a great effort, and they are still. I mean, we're still working. We are not finished. It will be, you know, more work moving forward.
Yeah, but I think there are also operational links because you're working also on some pilots together with them, right?
Yes, so we have 5 different pilots where we look at the different components of the PhPID, and now also we are looking into the FHIR kind of exchange for PhPID as well. So there we have both you know, EMA, US FDA, and other regulators that are committed to work on this together.
And maybe one final issue that I would like to have your opinion about is, and your role, possible role, is that although we progressed, and I think we progressed a lot in a few years' time, the degree of awareness and the need for training is still very much there. Do you intend to play a role related to training, and how?
Yeah, we will play one role at least. So what we are doing right now is that we're creating a very basic introduction to IDMP that should be available for everyone that is interested, because we have seen that there is a lack of knowledge really globally. These standards are very complex, and if you just sit down and try to read them, it's almost impossible to get a grip. And then, of course, we will also provide further training when the PhPIDs are operational, so that you can understand how do you use them in your local processes.
Okay, that's really great, and we'll be most happy to use all the resources and to distribute them widely. Thank you very much, Malin, for your time and for this deep illustration of your role in a very important and strategic, not only project, but global implementation.
Thank you, Luke, and thank you for inviting me to this great interview.